Hi, and welcome back to another Wellness Wednesday here at Spine Rehab Specialists. I'm Earl Hayden, one of the physical therapists here, joined again by Chris McMillen, and today we're going to show you 4 different exercise sequences you can do if you've just had a lateral release for the knee. All right, so the first thing we want to do is restore range of motion on the knee. So this is going to be very similar to a lot of the other surgeries that we've covered for the knee. So we're going to start with a heel slide, and we're going to do this actively. So here we have Chris who's putting on a pillowcase over his shoe. So just want to make sure the foot can slide nice and easily. So for a lot of doctors, they might limit your range of motion to maybe about like a 90-degree bend. Okay, so in other words, when you're bending the knee, they may not want you to bend that knee more than, go ahead and bend that to about like 90 degrees to about this far. It's almost like when your knee's bent like an L, okay? So you want to let that discomfort be your guide. After about a few more weeks after you've had that surgery, then you'll typically be cleared to go ahead and start pursuing bigger ranges of motion. Make sure you can bend the knee all the way. So you want to hold that stretch from anywhere between a good 10 to 20 seconds. 10 to 20 repetitions should be good. Again, let that discomfort be your guide. You shouldn't have any pain. You shouldn't feel like that knee wants to come out of place. All right, so next we want to make sure is you can fire that quad normally, because this surgery kind of affects that. Well, that kind of really does. So we're going to start with a basic quad set. So here we have this little cushion right underneath the knee, and Chris is just going to focus on tightening these quad muscles, just crushing that pad with the knee. Shouldn't be using the hamstrings. We're tightening this to push down into that pad. You want to hold that contraction for a good 10 to 15 seconds. 3 sets of 10 should be good. Once this becomes a lot easier and you have good control, we can progress to a short arc quad. So now we're putting this bolster right behind the knees, and right here we're still tightening this quad muscle, pushing down to the bolster and making sure you don't accidentally hit the person who's doing the exercise like what I just did. You want to do that. Again, 5 to 10 second holds. You can do this with both legs at the same time. That will help the injured side relearn this movement. That can also help with pain management, reminding the body that this motion is normal. Once you've done that, you have mastered that movement. Then we can do the full straight leg raise. So we're going to move this bolster out of the way. The leg is going to be straight. We're locking it, and then we're lifting up the whole leg. We should not see the knee bend on the way up or on the way down, okay? So what we don't want to see is go ahead and do a little extension leg. See how we're lifting up the leg and the rest of the foot just kind of lagging up behind? That's extension leg. We don't want that. That lets us know that this quad muscle is not firing like it needs to. You should be able to lock it, lift it, and love it, all right? So 2 to 3 sets of 10 of this should be good. Once you can hold this for a good 10 seconds, that's pretty easy. You can add some load to it. Now we're showing you another oldie but goodie of the classic clamshell exercise. Again, we want everything lined up from heel, hip, to shoulder. So we're gonna straighten this up just a little bit. Keep the heels together, toes are pulled up, and then just lifting up the top knee. We start with this exercise because this tends to put a little less pressure on the knee, especially after this surgery. You don't want to put more stress on there than you need to. Yeah, we want to feel that working the hips right here, working that glute muscle. Anywhere between 2 to 4 sets of 10 repetitions should be good. Holding that knee up for 5 to 10 seconds. If this is fairly easy and you're not having any irritation, definitely at the surgical site where the scars are, you can work on adding on a band on this, a little loop around above the knees. And the last exercise we're going to show is the Swiss ball bridge. So this is good for one, strengthening the hips and the hamstrings and helping us to stretch out the knee, make sure we get that full extension back. So Chris has his heels up on this ball, and then he's going to squeeze his glutes, clench really hard, and then lift the hips up. All right, and we can hold that for anywhere between 2 to 10 seconds. 2 to 4 sets of like 10 repetitions should be good. Once this becomes very easy, you can progress this to a Swiss ball leg curl or even doing this single leg. But today, after this type of surgery, you're probably just going to keep everything with 2 legs for a while until this leg catches up. All right, and those are 4 different exercises or exercise sequences you can do after you've just had a lateral release of the knee. So make sure to join us tomorrow for our Thirst for Knowledge Thursdays, where Harry and Anthony are going to go over this surgery in more detail and how these injuries occur, and more about how we can help you with this type of injury and surgery here at Spine Rehab Specialists.